Hello everyone, Divanshu here. Let's start with another video today. In this video, we're going to learn the parasympathomimetic drugs. Okay, so before starting this, we should go towards the last question that we have for you to answer. So the question was, which one of the following is a false statement about acetylcholine? So we have to take the wrong one. No. So first option is it causes vasodilation via nitric oxide. Yes, it generally acts through M3 receptor um and then releases nitric oxide through EDRF. No, EDRF endothelial dependent relaxing factor. Okay, so it is not used therapeutically due to its rapid degradation. Yes, because it is right, because there are various of acetylcholinesterase enzymes, butyrylcholinesterase enzyme, which are responsible for the rapid hydrolysis of acetylcholine. It crosses the blood-brain barrier easily. No, this one is wrong answer. In this, it can, because it is a water soluble. No, acetylcholine is a water soluble, so it cannot penetrate through blood-brain barrier and reaches into the brain. It cannot through. Also, because of the hydrolysis phenomena, it can be rapidly break down. So it will not ultimately go into the blood-brain barrier into the brain. It causes contraction of detrusor muscles. Yes, it causes contraction of detrusor muscles, detrusor or sphincter muscles. Okay. So now let's move towards the today's topic. What is parasympathomimetic drugs? So these drugs may directly activate the muscarinic receptors, directly acting, or may act by increasing the availability of acetylcholine at the synaptic cleft. So there are two types of drugs: directly acting or indirectly acting. So the directly acting do what? In the case of directly acting, they just directly act on the receptors, whether it can be a muscarinic receptor or it can be nicotinic receptor. But in the case of indirectly acting, these drugs do what? These drugs inhibit the enzyme which are responsible for the hydrolysis of acetylcholine. So what is that enzyme? Enzyme is acetylcholinesterase. So generally, these drugs are responsible to inhibit those enzymes, acetylcholinesterase, that will ultimately leads to increase in the availability of acetylcholine in the synaptic cleft. So let's uh, go towards the classification of these drugs, parasympathomimetic drugs. So these are divided into two parts: directly acting and indirectly acting. So directly acting are further divided into two parts: cholinesters and alkaloids. So cholinesters can be learned through a trick, that is Mac burger, MacD burger, McDonald's burger. No, so you can learn through it. Mac burger: M for methacholine, A for acetylcholine, C for carbachol, and B for bethanycol. So in this cholinesters, you need to remember that carbachol has both the activity, whether it is muscarinic or nicotinic. So carbachol has both the activity, that is muscarinic as well as nicotinic activity. Second one is alkaloid derivatives. So alkaloid derivatives can be learned through array give me pillow. Array give me pillow. Array for arecholine, me for muscarine, and pillow for pillocarbon. Is it very easy to remember? No. So array give me pillow. Arecholine, me, muscarine, pillow for pillocarbon. So these are the direct link drugs which are directly acting on the receptors, nicotinic receptors or muscarinic receptors. Okay. Then now in the indirectly acting, there are two types of drugs: reversible and the irreversible. That is reversibly binding towards the acetylcholinesterase enzymes, or irreversibly binding onto the acetylcholinesterase enzymes. Okay. So in the reversible case, there are two types: lipid soluble and water soluble. Why they are lipid soluble? Because in the structure, whenever you see structure of these drugs, physostigmine, donepezil, dacryl, galantamine, these are tertiary amino acids. These are tertiary amine groups are present, not amino acids. In their structures, chemical structures, tertiary amine groups are present. So that is responsible for the high lipid solubility of particular compound. Tertiary amine tertiary amine group is responsible for increasing in the lipid solubility of that particular compound. So these drugs includes physostigmine, donepezil, tacrine, galantamine, and rivastigmine. Okay, so here you can learn this through a trick, that is Pandit G gone to river. Pandit G gone to river. P for physostigmine, D for donepezil, T for tacrine, gone for galantamine, river for rivastigmine. Okay, Pandit G gone to river. Now let's move towards the water soluble part. So these drugs are quaternary ammonium compounds. Okay, so these are quaternary ammonium compounds. That quaternary ammonium group are responsible for the water solubility of these compounds. Okay, so these in this category, pyridostigmine, etrophonium, and neostigmine are categorized. Okay, so this can be learned through pen ink is water soluble. P for pyridostigmine, E for etrophonium, and N for neostigmine. Okay, so pen ink is water soluble. Now let's move towards the irreversible one. Irreversible ones are responsible to bind the acetylcholinesterase enzyme in the irreversibly manner, so that it can be inhibit those enzymes in a very long duration of time. So this includes carbamates and organophosphates. Okay, so the carbamates are carboxyl, propaxol, and aldehyde. Carboxyl, propaxol, or aldehyde. So this can be learned through car is proper and all right. Car for carboxyl, proper for propaxyl, and all right for aldehyde. Okay. Now rest of the compounds are automatically goes into the organophosphates. So you have learned the trick for choline esters, you have learned the trick for alkaloids, you have trick for reversible lipid solubles and water solubles. Okay, and also for carbamates. But the automatically all the other rest of the compounds will automatically into the organophosphates. So these are not nothing but the insecticides of the nerve gases. Okay, so malathion and parathion are particularly the insecticides. Tabun, sarin, soman are nerve gases. Okay, so but ecothiophyte is the only drug in this category which has a therapeutic activity, which has a therapeutic use. Ecothiophyte are generally used in the glaucoma. Okay, so these are the tricks through which you can learn these classification. Okay, Mac burger is for cholinesters. Array give me pillow for alkaloids. Pandit Ji gone to river for lipid soluble drugs. Pen ink is water soluble for water soluble drugs in the case of indirectly acting. Whereas for irreversible carbamates, car is proper and all right. So carboxyl, propaxol, and aldehyde. Okay, and rest of the drugs will automatically in the organophosphates, in which malathion, parathion are insecticides. Ecothiophyte is the only drug which has a therapeutic activity, which is a therapeutic use in the glaucoma. The rest of the drugs are insecticides or nerve gases. Okay. So what are the parasympathetic drugs? These are drugs are activate the muscarinic receptors or nicotine receptors. When they are acting on the muscarinic receptor, on the nicotinic receptor, they are called as the directly acting. But when they are inhibiting the acetylcholinesterase enzyme, then they are the indirectly acting. Okay, let's move towards the particular drugs in the directly acting parasympathomimetic drugs. So these drugs are the esters of choline and maybe natural alkaloids, as we have discussed before also. In the directly acting class, there are two types: esters of choline, choline esters, as well as the natural alkaloids. Acetylcholine, muscarine, nicotine, pilocarpine, aerocholine. These are the choline natural alkaloids. Okay, and synthetic derivatives are methacholine, carbachol, or methnicol. These are the esters of choline. Now, acetylcholine is not used clinically because it metabolized very quickly via cholinesterase in the plasma. As we have told you before also in this previous class, because acetylcholine is very rapidly hydrolyzed through cholinesterase enzyme in the plasma or in the synaptic cleft. That's why it has not a clinical relevance. Okay, so it is not even affected by the IV route because cholinesterase enzyme are also present in the plasma also. Okay, then the methacholine, which is the esters of choline, has maximum action on myocardium. In the previous lecture, I have given you a trick how to learn the methacholine, which has a particular use on the which organ. So M for methacholine, M for myocardium, that is heart. No, so M for methacholine and M for myocardium. So it can be inhalationally given for the diagnosis of bronchial hyperactivity. So one of the other thing that you must learn about methacholine, that it is given for the diagnosis of bronchial hyperactivity in patients who do not have clinical apparent asthma. And this particular test is also known as the methacholine challenge test. Okay. Now, B for Bethany call and B for bladder. In the previous lecture, I have told you that B for methylene and B for bladder. So methylene is mainly used for its action on the urinary bladder and has no nicotinic activity. No nicotinic activity on methacholine, no nicotinic activity in methylene, but carbachol has common activity on nicotinic and muscarinic receptor. Carbachol, C for carbachol and C for common activity. Through this you can learn it. Okay. Now, pilocarpine is used in glaucoma due to its pupillary constrictor action. So when that pupil, eyes of pupil get constricted, that is responsible for miotic. That term is called as miotic. Okay. However, because of its very short of duration, intraocular tension may increase. Because it is a very short duration of action, intraocular tension or the pressure, it may be increased. So let me tell you what is the ideal pressure in eyes. So you can write somewhere that 22 mm per Hg is the ideal pressure in the eyes. Above that, it may be cause glaucoma. If someone has a pressure above 22 mm per Hg, then that person might have glaucoma. Okay, so it is the upper range. At the last limit of the intraocular tension is 22 mm per Hg. Okay, so carbachol has common activity C for carbachol, C for common activity on nicotinic and muscarinic receptors. Pilocarpine and cevimeline are used to try dry mouth associated with Sjogren syndrome, because, as I've told you, that if anticholinergics are given, anticholinergics being the drugs which are acting against the cholinergic system. Cholinergic system are responsible for SLUD, SLUD, salivation, lacrimation, urination, and defecation. And cholinergic drugs consist of these types of drug: acetylcholine, methacholine, methnicol, pilocarpine, carbachol, etc. etc. So these will initiate the parasympathetic response. But if you have a dry mouth is in the condition of anticholinergic condition, no? So to treat that, what kind of drug should be given? These cholinergic types of drugs should be given. So pilocarpine and cevimeline are used to treat dry mouth associated with Sjogren syndrome. So this Sjogren syndrome is associated with the radiations. Whenever a cancer patient, receives radiations in the neck or the saliva, whenever they have a oral cancer and a head and neck cancer, so the radiation goes directly into their throat, salivary glands, etc., etc. So due to that, dry mouth can be occur. So for treating this dry mouth condition, pilocarpine or cevimeline can be given. Okay. Now, the indirectly acting parasympathomimetic drugs. So these are acting by the enzyme, inhibiting the enzyme acetylcholinesterase, as I have told you before, that it acts generally through inhibiting the enzyme acetylcholinesterase, thus increasing the availability and prolonging the action of acetylcholine. Okay, so through that, whenever these acetylcholinesterase enzyme gets inhibited, the acetylcholinesterase duration of action and the availability gets increased. So these are also known as anticholinesterases. These types of drugs which are acting indirectly are also known as anticholinesterase drugs. Okay. Now, so what are these drugs? Which are these drugs in comes under the indirectly acting. So these drugs are physostigmine, neostigmine, pyridostigmine, entroponium, tacrine, and rivastigmine. These are reversible indirectly acting parasympathetic drugs. Okay, so physostigmine. So these are some notes which are important for you. Through these notes, many of the questions have arrived and came into the previous GPAT exams. Okay, So physostigmine is used in glaucoma as a miotic drug, and in belladonna, that is atropine poisoning as a specific antidote. So physostigmine, because of it has a cholinergic um, activity in it, and these physostigmine act through the M3 receptor. M3 receptor are present into the circular muscles of eye. So these circular muscles of eye when gets activated, these are GQ mediated. So when M3 receptors are GQ mediated, and these are located on the circular muscles of eye, through that GQ mediated, through GQ mediation, contraction will occur. So there will be a contraction of circular muscles. So through contraction of circular muscles, there will be a meiosis in eyes. That is constriction of pupil. Okay, through through that it will be called as a miotic drug because it is causing the meiosis. Okay, also it is a specific antidote for atropine or belladonna poisoning. Here is a reversible also. If we do have a poisoning of physostigmine, so you will take atropine as a specific antidote. Okay. So next one is neostigmine. Neostigmine is of water soluble reversible drug. Now, so these are preferred for the treatment of myasthenia gravis. So neostigmine has both the activity, muscarinic receptor activity as well as the nicotinic receptor activity. And these are also responsible for the treatment of myasthenia gravis. Myasthenia gravis is the autoimmune disease for the skeletal muscles, generally possess the NM activity, neuromuscular junction, NM receptor activity. Okay, pyridostigmine is having the same kind of actions of neostigmine but is longer acting than neostigmine. Okay, Adrophonium. Adrophonium is a short-acting synthetic anticholinesterase and used in the diagnosis of myasthenia gravis. So these are very important. Note that adrophonium is a short-acting synthetic cholinesterase. First point, and second point is which is very important, used in the diagnosis of myasthenia gravis, which is also known as the tensilon test. Okay. Tacrine. Tacrine was a drug of choice at one time for Alzheimer's, but because of the hepatotoxicity, diarrhea, and other complication, it is now banned. Okay. So other drugs are preferred for Alzheimer's. Rivastigmine. Rivastigmine approved for the treatment of dementia in Alzheimer's as well as the Parkinson's disease. Now let's move towards the irreversible anticholinesterase. So except ecothiopate, as I've told you before, except ecothiopate, these are not used therapeutically. Ecothiopate is used in the glaucoma. Okay, I have told you in the classification part only. So other drugs are used as insecticides and are important to their potential to cause poisoning. Symptoms of LNT and anticholinesterase poisoning are simply as the extension of pharmacological actions of acetylcholines and are manifested as pinpoint pupil. Pinpoint pupil, why? Because there will be a constriction in the circular muscles. Also, salivations, lacrimation, sweating, coma. These are all the cholinergic actions of acetylcholine. So, whenever there will be an anticholinesterase poisoning, automatically there will be an increase in the action of acetylcholine in the body. So what will it do? It will do pinpoint pupil. The pupil size will be very decreased, no, because of the constriction of pupil, because of the M3 mediation, M3 which is GQ mediated receptor. Also salivation, lacrimation, sweating, coma. Apart from that, SLUD. No, SLUD for S for salivation, L for lacrimation, U for urination, D for defecation. So these types of manifestation can be seen whenever there is a poisoning of anticholinesterases. Okay. Now let's move towards the uses of cholinergic drugs. So there are two uses. Muscarinic uses because of the muscarinic receptors. Nicotinic uses because of the nicotinic receptors. So in the case of muscarinic uses, there are used for glaucoma, Alzheimer's, and belladonna poisoning. So for glaucoma, three types of drugs can be used. Pilocarpine as a M3 mediation for as a meiotic drug. Physostigmine also for the meiotic drug. Ecothiopate also for the meiotic drug. All the miotic drug are useful for glaucoma. Okay. Alzheimer's. How? Alzheimer's will be occur in brain only. So what types of drugs can be given in Alzheimer's? Only which are lipid soluble in nature. So tacrine, donepezil, rivastigmine, and galantamine. Apart from tacrine, all the drugs are therapeutically in use for the Alzheimer's. Tacrine is banned now because of their hepatotoxicity and diarrhea. Okay. So for donepezil, rivastigmine, galantamine, these are responsible. These are being taken therapeutically for Alzheimer's. For belladonna poisoning, physostigmine can be given. Syndrome, as I have told you before also, Sjogren syndrome is a dry mouth condition occurs through when a cancer patient having radiations around his neck or head area. And because of that, the throat or the salivary gland gets damaged and leads towards the dry mouth. So these pilocarpine and cevimeline are responsible for exaggeration of cholinergic system in the body and treating the dry mouth condition. Okay. For post-operative paralytic ileus, bethanycol and neostigmine can be given. For urinary retention, bethanycol and neostigmine can be given. Okay. Methacholine, as I've told you before, diagnosis of bronchial hyperactivity can be used. For nicotinic uses, reversible of muscle relaxants, neostigmines, and pyridostigmine can be given for myasthenia gravis. Okay. Also, this one is the important one for cobra bite poisoning. For cobra bite, neostigmine and pyridostigmine can be given. For diagnosis of myasthenia gravis, edrophonium, which is the shortest acting drug, these are responsible for the diagnosis of myasthenia gravis. What is myasthenia gravis? Myasthenia gravis is an autoimmune disease in the skeletal muscles, particularly resembles NM receptor, which are nicotinic neuromuscular junction. Okay. Treatment is neostigmine and pyridostigmine. So let's move towards now the questions for you. So the important questions are, first question is, which of the following is a reversible anticholinesterase agent? Options are organophosphates, physostigmine, 𝘂𝙀𝙎𝙀, parathione. Next question is, which of the following is a quaternary ammonium compound that does not cross the triple B? Pilocarpine, physostigmine, neostigmine, or rivastigmine? So you have 10 seconds to answer. Answer now. So let's see the answer. The answer is the physostigmine, which is a reversible anticholinesterase enzyme, anticholinesterase agent. So physostigmine do what? Physostigmine is a reversible anticholinesterase agent, which is a lipid soluble in nature, and these are responsible to inhibit the acetylcholinesterase enzyme in reversible manner. Others are irreversible anticholinesterase agent. Next question is, which of the following is a quaternary ammonium compound that does not cross the triple B? So I have told you a concept that whatever the drug has lipid solubility, in that compound you will see a tertiary amine group. Okay, that tertiary amine group are responsible for the lipid solubility in that compound. But if we talk about the water solubility of that compound, group which is a quaternary ammonium group, that quaternary ammonium group is responsible for the water loving capability of that compound, that is hydrophilic in nature. Okay, water solubility in nature. So in these, among these, which one has a quater ammonium compound? So which one is the water soluble compound? So automatically I have told you the trick. The pen is water soluble. Pen ink is water soluble. P for pyridostigmine, E for edrophonium, and N for neostigmine. These are the water soluble. Rest of all are pilocarpine, physostigmine, and rivastigmine are the lipid soluble. So neostigmine is a water soluble drug which has a quaternary ammonium compound in it, and that is responsible for their not crossing the triple B, that is blood brain barrier. Okay. So the next question is, which parasympathomimetic is used in the treatment of non-obstructive urinary retention? Okay. Options are atropine, bethanycol, pilocarpine, physostigmine. Which of the following is used in atropine poisoning? That one is very simple, no? So pilocarpine, bethanycol, physostigmine, and neostigmine. Now you should answer in 10 seconds. Let's move. So before answering this question, there is a something for you. There is a phrase in Hindi. समय को समय दो, वह खुद को तुम्हारे लिए बदलेगा. That means in English that give time its time, and time will transform itself for you. So you should have some patience, be consistent around your studies, and give time its time. This will shape your future very soon. So now let's move towards the answer. Bethany call is used in the treatment of non-obstructive urinary retention. Okay, B for Bethnicol, B for bladder, as I've told you before also. So, which of the following is used in atropine poisoning? Physostigmine. And which one is used for the physostigmine? Atropine. Okay. Now, next one. Which of the following is not a use of cholinergic drug? Not a use of cholinergic drug. Postoperative ileus, Alzheimer's disease, motion sickness, or glaucoma. Which of the following is a centrally acting anticholinergic used in dementia? Okay, so you have 10 seconds to answer. So the answer of the first question is motion sickness. So as we have seen before also, most of the cholinergic drugs can be used in the postoperative ileus condition, Alzheimer's disease, and the glaucoma also. But none of the cholinergic drugs are used for motion sickness. Whereas, which of the following is a centrally acting anticholinesterase used in dementia? So, what are the drugs which has used for dementia? Dementia is a brain disorder. Okay, so that kind to treat the dementia, the drug should reach into the brain only. That is the first condition. So, to reach in the brain only, that should give the answer to you because the donepezil have a lipid solubility because of its tertiary amine group present in this structure that reflects is centrally acting anticholinesterase activity. Okay, so because of the tertiary amine group present in the donepezil, this drug donepezil act as a centrally acting anticholinesterase drug which are used in dementia or Alzheimer's. Okay, now so these are the questions for you. Which of the following cholinergic drug is resistant to hydrolysis by cholinesterase? Next one, toxicity of cholinergic agonist includes all except. Okay, so these are the questions that you have to answer this in the comment section. Till then, bye bye. I have some other works also for this video. This will be a short video for you. So let's meet in the next lecture. I hope you like this video. I hope I made you clear some concept around the cholinergic system. In the next video, we will look onto the anticholinergic system. So till then, bye bye and stay with GDC.